So there have been so many talks about complications in pregnancy. I'm sure if you have been going through social media, you will see all the bad news about women who have gotten pregnant, who have died from pregnancy, which now begs me to ask the question, is pregnancy really a death sentence? Is it? Hello and welcome to Life Talk with Dr. Chioma. So, the outcomes of two people's pregnancies could be so different based on how ready they are for complications. Pregnancy is not an easy state, it's not your normal state. Your body is not doing the normal thing it is supposed to do. Your body is put through double the amount of stress it was supposed to go through before. So it is not an easy state, it's not the normal state. So we can expect some complications that could arise depending on your body, depending on the pregnancy, depending on your family history or other things in the environment that could affect you. Yes, some people will go through pregnancy without experiencing anything. But if by any chance your pregnancy is complicated by anything, how prepared are you to handle it? How ready are you, to handle the problems that could come? The first thing to do once you're getting ready to get pregnant or you know that you're pregnant is to start putting money aside. Pregnancy is a very expensive venture. Is it to pay for the hospital bills, to pay for the delivery fees, or if there are any complications, there could be need for big finances. So what do? Start putting money aside. If you know that, I'm ready to get pregnant, then you should start saving up for pregnancy. Now, I know finances are not easy, but please, we need to save. If you can get a health insurance scheme for yourself, for your wife, for your family, please invest in that, especially if you're earning a salary that comes regularly. Invest in health insurance scheme. So many hospitals are using them now. Find out the one that is used by most hospitals that you want to attend and register with them. It will help you. It will help you deal with all these deposits or no deposits and all that. Please, health insurance schemes have come to stay. Find one that is good for you and for your family and invest in it. Now, the next thing is to make sure you find a very good health facility that will take you through the pregnancy period and even to the delivery state. If everything goes well and fine, good. You can use any of the health facilities, but make sure that your health facilities also have a good referral system. Please check the size of your pockets while finding hospitals that you can use. We know that private hospitals are more expensive. If you cannot afford that, please try to use a government facility. The money is subsidized, the cost is subsidized there. Find a good one and make use of it. Also, please prepare. Note, how am I going to get to the hospital in case an emergency arises? How are you going to get there? Who is going to take you there? What if there's traffic? How have you tried to circumvent that? Which hospital are you using? Is it close by? Can you get there on time? Those are the things to consider when choosing a health facility. Is it good enough? Do they have a blood bank? Can they handle an emergency? Now, another thing that is very important is antenatal care. I find it very disturbing that so many women can go the length of 9 months without even being properly checked at a health facility. For antenatal care, there are primary health centers everywhere. There are nurses, there are community health workers that are trained to check you, to recognize any danger signs. So please make use of the ones close to you. Go to any hospital, make sure you attend antenatal care. It is in antenatal care that they will find problems, issues that might be problems for you later, issues that might turn to emergencies later. When you go for antenatal, they measure your blood pressure. If there is hypertension, they are going to see it. If there is diabetes, they are going to see it. If there is any problem, if there are proteins in your urine, they are going to find it. That is why antenatal care is good. If your baby is not growing well, they are also going to find it. So please make sure that you take your antenatal care and visits very seriously. Now, another thing I find very disturbing is that women, when they are told, okay, you have this, you need to do a CS, you find them running away. You find them going to traditional birth attendants just to avoid cesarean section. Why do you think cesarean section is bad? Who has demonized it so much to make you think that it's bad? Go to the description box and go and see some of the reasons why you are asked to do a cesarean section or a CS and how it is not bad at all. Now, some of these traditional birth attendants that we go to, I'm not demonizing them. I'm not saying they are not good, but some of them do not know when to refer. Some of them do not know when to stop. I mean, you have been told that your baby is breech or something like that, and your baby cannot come, and you go to hear something. You go to a traditional birth attendant to turn the baby. Why? Why do you think in those using crude methods that you're going to turn the baby and everything is all right? In my practice, I have seen so many women go to do this and come back almost half dead. Anything could happen. You're turning everything. They could rupture your placenta. Your placenta could separate. I mean, the cord could wrap around the baby's head, and so many things could go wrong. So why would you risk doing that in a facility, in a place where you know that if there's any emergency, they cannot bring out your baby as quickly to save you and to save your baby's life? Women, some of us are going to have complications in our pregnancies simply because we did not space our babies. We did not allow our bodies to rest. Today, if you're one of those people, you don't have a family planning method, you don't have any plan to space your babies, you don't have any plan to let your body recover. When the baby enters, it enters. When pregnancy enters, it enters. Please go right now, check my description box, check on the different methods of family planning that I have discussed. Find a good one that is good for you. Some of these complications can be avoided simply by letting your body recover from the previous pregnancy and rest before going again. Do you hear me? Now, some of us, when we see danger signs, we stay at home and start observing. No, it is better you go to the hospital and they tell you that everything is fine than for you to stay at home and think by yourself, only on your own, that everything is fine. Some of the danger signs to check for: if you start seeing blood or excess bleeding from your private part, please rush to the hospital before it is too late. Secondly, if you start feeling that your baby's movement has reduced, no matter what it is, if it has reduced from what it used to be, your baby was so active and now your baby is no longer active, quickly rush to the hospital. Don't wait to be told. Don't wait till you don't feel anything at all before you start going. Also, if you start feeling dizzy, unnecessarily weak, you start feeling faint and having severe headaches, my sister, go to the hospital. That could be a sign of increased blood pressure and preeclampsia setting in. Please go straight to the hospital and be reassured there. Let them check you and reassure you that everything is fine before you say everything is fine. I usually tell people, any pain you feel in pregnancy, get to the hospital. Let them tell you, oh, this is normal pain that you experience, before you go home. Do you hear me? Now, for some of my women that relegate their decisions to their spouses, I am not saying it is not good to agree, but please be responsible for your health. You know how you're feeling. You know what is wrong with you. Your spouse might not be feeling what you're feeling. He cannot make those decisions for you. If a doctor is telling you, you have to do a CS, you're the one, you own your body and you know what it means. If you don't do a CS and something happens, why are you allowing someone say, no, I don't want my wife to go through a CS? Make your decisions. Live for yourself and live for your children. A cesarean section is just a surgery to bring out your baby. After that, you stitched up, you will heal. And you know what? You will be alive for yourself and for your babies. Do not listen to anything any other person has to say. Do not say, oh, I want to be a Hebrew woman, this, that, and you die and leave your other children unattended to, or you leave that baby that you've brought into the world, or when finally you agree to it, the damage has already been done. Please take charge of your health. Decide that I want to live. Decide that I want to live for myself. I want to live for my spouse. I want to live for my children. I want to enjoy this life. If you do that, then you're going to make those decisions in self-awareness. Do not allow anybody to make decisions that will be detrimental to your health as a full-grown, active adult. Now, we can see that pregnancy is only a death sentence when you don't do the things you're supposed to do. I am not saying that everything is perfect with our health system or everything will go according to plan, but please do your possible best. Do your possible best to make sure that pregnancy does not end in death for you. Bye. Till next time, take care of yourself and take care of your health.